available using your own body's natural healing ability. Nobel Stem offers a simple, affordable treatment called platelet-rich plasma, PRP, a stem cell therapy using your own blood elements to accelerate and intensify your body's healing ability. Pro athletes use it and millions of others.
I treated my shoulder, knee, and back pain without surgery, and now I have no pain.
Pain relief without surgery or medication. Contact Nobel Stem today.
Curación de dolor crónico está disponible a través de su propio cuerpo y capacidad de curación natural. Nobel Stem ofrece un tratamiento simple y económico llamado Platelet Rich Plasma PRP, una terapia de la célula que usa alimentos de su propia sangre para acelerar e intensificar curación de su cuerpo. Atletas profesionales y millones de otros lo usan.
Me traté mi hombro, rodilla y dolor de espalda sin cirugía y ya no tengo dolor.
Alivio de dolor sin cirugía o medicamentos. Contacte a Nobel Stem hoy.
Tonight, by request of many audience and people who've been seeing my program in satellite TV, requested that a lot of members of the family do not speak very fluent Persian, so they requested that this program be broadcasted in English, that both young and older people who wants to understand the stem cell treatment for all of their medical problem, especially the pain management. So we decided to broadcast this program tonight in English, very simple English, and hopefully audience will have any critique, because this is the testimonial and the power presentation done very kind of by amateurs. I am not a computer savvy, but however the principle of PRP and stem cell is used for many years in United States and the whole world, and also celebrities, a lot of football players using the stem cell treatment for their injury in the especially most famous one, Kobe Bryant, that a very famous basketballist using PRP stem cell in his injury and avoiding surgery. I have some basic principle of PRP I'm going to explain for people who are suffering from pain, whether the pain is from neck, shoulder, back, and knees, ankle, hip, or whether this is carpal tunnel syndrome. In the hand, they have numbness, tingling sensation, or they have neuropathy in their lower extremity, their legs, or they have other soft tissue injury, rheumatoid arthritis. I would explain after I have a basic principle of anatomy and also basic principle of the platelet-rich plasma or PRP and stem cell, autologous stem cell that we harvested from either bone marrow without pain, or from adipose tissue or fat tissue from either the buttocks or from peri-umbilical area in the belly. And platelet-rich plasma is harvested from peripheral blood. We draw the blood and we put it in a special centrifuge and separate the platelets and concentrate the platelet to the 10 times more than circulating platelet in the blood. Why platelet? Platelet is a coagulation factors that when we have a bleeding cause clotting and prevent further bleeding. So when you have a wound, the wound has to be the bleeding has to stop. So platelet release all growth factor and coagulating factor to make a new bridge between the edge of the wound to create a barrier from bleeding. So each platelet has about 90 growth factors. These growth factors are very important on new tissue formation and also recruiting the white blood cell and fibrocyte and even mesenchymal stem cell that existing everywhere in the body, from skin to the bone and muscle. Everywhere we have mesenchymal stem cell in addition to circulating stem cell that are in the bloodstream. When we draw the blood from about 60 cc blood from the vein, from brachial vein, and that we put in a special centrifuge, and we concentrate and take that concentrate from that specimen and activate with either laser or by calcium chloride. Obviously, the blood is anticoagulated before when we draw the blood by either heparin or sodium citrate, because we want keep the plasma, not serum. Because if blood coagulate, we lose the platelet. Platelet are our ammunition to heal body. So if a simple calculation in each cc of blood has an average person from low to highest. Average people, they have 150 to 140 to 450 platelet or 400,000 platelet in 1 cc of blood. Then when we concentrate this average platelet, assuming 250,000 per cc regular blood, when we concentrate this 6 to 10 times to become 2.5 million of the platelet in 1 cc of concentrate. Then you made time this about 90 or 100 growth factor that exist in the platelet. That one of them is a neovascularization growth factor. The other one is collagenesis factor, platelet drive growth factor, and so on and so forth. If I want to mention all 90 growth factor, we lose all the time that we have here. Anyway, so when we inject that concentrate to, let's assume in the neck, if somebody has a bulging disc in the neck or whiplash injury in the neck, this recruit the collagenesis factor and also neovascularization factor, that the ligament that hold the vertebrae together in the neck reinforce and regenerate collagenesis there, collagen that we need to hold the disc in between the vertebrae of the neck or in the back. Or we may inject this in the knee that already has degenerated meniscus there, the cartilage, or collateral ligament that holding the knee, both sides, the lateral and medial collateral ligament that are holding the knee, both sides, or the patellar ligament, or the cartilage between femur and tibia that been worn out by overuse or trauma, or meniscus tear. Obviously, for knee, we have different type of ammunition in addition to PRP, which we use the stem cell from either bone marrow or fat cell. Fat cell is a very rich source of stem cell that can be used for both regenerative medicine in skin, that for aesthetic medicine, that we do that for the facial rejuvenation, in addition to use for pain management, for a weight-bearing joint like knee and hip and ankle. In addition to this application, there are many more applications for platelet-rich plasma or PRP and stem cell treatment, which is all from patient own stem cell. We use that autologous stem cell, autologous platelet. There is no side effect, there is no rejection, there is no banking. Is in 15 minutes to half an hour, you have both ammunition to treat the patient. For I need to have the slide. This is the structure of the neck that you see the vertebral arteries passing through the both sides of the neck, and there are discs in between each vertebra. This is C1, that under the skull, C2 and the atlas here, and C3, C4, C5, C6, C7, and the most common area of the bulging disc or herniated disc in the C4, C5, and C5, C6, or cervical 4 or cervical 5 or cervical 6. Those areas, the reason you have cervical disc in this area, because this most movable and the most mobile part of the neck to all direction. And we inject the platelet-rich plasma where the nerve root are not present, and this kind of tighten the belt that built around this vertebrae area from anteriorly and posteriorly, both in the front and in the back of the neck, and is kind of a sleeve, very tight sleeve. And people who have whiplash injury, or they have lifted heavy object, or for any reason they have this before committing to a surgery, and they could have treatment with their own plasma and stem cell, and not going through this surgery. Could you show the number 1 video? Number 1 video, please.
We are with Mrs. Kimberly. Mrs. Kimberly, could you tell us about before PRP, how long you had that problem?
I was in a car accident April 24th of 2012, and the car accident was so severe that I lost consciousness and the whole left side of my body was injured. And I went to see several different doctors, orthopedics, physical therapy. Nothing was improving until I found Dr. Nobel. And even the physical therapist had said that they didn't think that the therapy was helping. I had MRIs done. Surgery was an option that was recommended by the orthopedics. Either neck surgery and or shoulder surgery, and that is not a route that I wanted to take. So I started seeing Dr. Nobel, and he suggested PRP. I did my own personal research on PRP, and knowing the pros and cons of surgery, and the costs was greatly reduced to being PRP. Knowing that Kobe Bryant had done it helped. Mm-hmm. And so I decided to do the PRP. We did the PRP December 18th. And prior to doing the PRP, I experienced difficulty blow drying my hair, holding a coffee cup, everything on my left-hand side, my left hip, knee, shoulder, elbow, neck. It was difficult for me to sleep at night because I would get these horrible pains in my neck. I got headaches all the time. I virtually lived on ibuprofen, coupled with a few pain pills, and today that's not the case. After the PRP,